Erection is a complex balance between the cavernosum smooth muscle, the pelvic nerve, and vascular status. Erectile dysfunction, or ED, is a common condition where men have difficulty getting or keeping an erection. This can be a frustrating and, embarrassing problem, but the good news is that effective treatments are available. One such treatment is PDE5 inhibitors, a class of medications that help men achieve and maintain erections. These medications have an excellent safety profile and are convenient for patients. However, they need special consideration, and special instructions must be followed to maximize the therapeutic effect. To understand how PDE5 inhibitors work, it's helpful to understand the mechanics of an erection. When a man is sexually aroused, blood flow to the penis increases. This increased blood flow causes the penis to become erect. PDE5 inhibitors work by relaxing the muscles in the penis, which allows for increased blood flow. PDE5 inhibitors are not aphrodisiacs. They do not cause erections on their own. Sexual stimulation is still required for these medications to work. According to the guidelines, you need to try at least 6 times to evaluate the final response to PDE5 inhibitors. It's important to note that PDE5 inhibitors are prescription medications and should only be taken under the supervision of a healthcare professional. Several different PDE5 inhibitors are available, each with its own set of benefits and drawbacks. The 3 most commonly prescribed PDE5 inhibitors are sildenafil, known as Viagra, Tadalafil, known as Cialis, and Vardenafil, known as Levitra. Sildenafil, or Viagra, is the most well-known PDE5 inhibitor. The low dose is 20 mg, and the full dose is up to 100 mg. For sildenafil, the absorption is affected by food intake, so you have to take it on an empty stomach with no food or alcohol for at least 2 hours, and you will need sexual stimulation starting 1 hour after taking sildenafil. Tadalafil, or Cialis, on the other hand, can last for up to 36 hours, earning it the nickname the weekend pill. The low dose is 5 mg, and the full dose is up to 20 mg. This makes it a good option for men who want to avoid having to plan their sexual activity around taking a pill. This is not affected by food or alcohol intake, but the medication's absorption is slow, and it needs a longer time to have a therapeutic effect. You have to take it at least 2 hours or more before having sexual activity. This medication lasts for 48 hours. Always wait at least 48 hours between Tadalafil 20 mg doses. Vardenafil, or Levitra, has a low dose of 5 mg and a full dose of up to 20 mg. Similar to sildenafil, it must be taken on an empty stomach and requires sexual stimulation 1 hour after taking it. Remember, for all PDE5 inhibitors to work, sexual stimulation is needed. It's important to follow your doctor's instructions carefully and not take more than the recommended dose. PDE5 inhibitors work by blocking the action of an enzyme called phosphodiesterase type 5, or PDE5. PDE5 is found in the smooth muscle of the penis and is responsible for breaking down a substance called cyclic guanosine monophosphate, or CGMP. CGMP plays a crucial role in achieving and maintaining an erection. When CGMP levels are high, the smooth muscle in the penis relaxes, allowing for increased blood flow and an erection. PDE5 inhibitors prevent PDE5 from breaking down CGMP, which leads to higher levels of CGMP in the penis and improved erectile function. It's important to note that PDE5 inhibitors do not work for everyone. Some men may not experience any improvement in their erectile function, while others may experience side effects. While PDE5 inhibitors are generally safe and effective, it's important to be aware of the potential risks and side effects before taking them. Common side effects of PDE5 inhibitors include headache, facial flushing, heartburn, nasal congestion, and visual disturbance. Also, some patients can report severe muscle pain with Tadalafil. These side effects are usually mild and tend to go away on their own. PDE5 inhibitors can interact with certain medications such as nitrates and nitroglycerin used to treat chest pain. Taking PDE5 inhibitors with these medications can cause a dangerous drop in blood pressure. PDE5 inhibitors are contraindicated in patients with a history of macular degeneration, retinitis pigmentosa, non-arteritic anterior ischemic optic neuropathy, history of melanoma with recurrence or positive lymph nodes, and patients who are taking nitroglycerin or nitrates, and patients who have chest pain with exercise or recent cardiovascular event. Causes of no response to PDE5 inhibitors are no proper ingestion of medication, anxiety and sexual performance, deterioration of erectile tissue, and severe low testosterone. Some examples of incorrect use are lack of sexual stimulation, medication taken with a large meal, and not having enough time after taking the pills. Before starting PDE5 inhibitors, it's essential to talk to your doctor about your medical history and any medications you're taking. They can help you determine if these medications are safe for you and advise you on the appropriate dosage. If you're struggling with ED, talk to your doctor. They can help you determine if PDE5 inhibitors are right for you and discuss any potential risks and side effects.